Hi, this is Dr. Craig Fasullo, and I'm here to talk to you about all things cardiovascular and heart. This is a functional and naturopathic approach to heart disease, aka how to develop and maintain a strong and healthy heart. I'll often do this lecture during the month of February, which is Heart Health Month, but it turns out there's never a bad time to talk about the heart. So the first thing is we get into what exactly is heart disease. What are we talking about when we're talking about heart disease and cardiovascular disease? And we're talking about a number of things. We're talking about the heart as in the pump, and we're talking about the vessels, the vascular system, including coronary artery disease. Your coronary arteries are what directly feeds back into your heart. High blood pressure is a vascular issue. Hyperlipidemia, a cholesterol issue, which has an impact on some of these other things, but is not, as we'll talk about, the only player in the game. And then, down at the end there, heart attacks and strokes, the things we're obviously trying to avoid. Some sobering statistics. Uh, by the numbers, yes, the leading cause of death in men and women in the United States is still cardiovascular disease. Heart attacks every 34 seconds. Every 60 seconds, someone in the United States dies from a heart disease related event. There's a lot of financial expenditure that is correlated to all this heart disease. And noteworthy down here that heart disease is something that affects women as well. So we're talking about 1 in 31 female deaths from breast cancer as compared to 1 in 7.5 from heart disease. Down here at the bottom, the American Heart Association reports 50% of men and 64% of women who died suddenly of coronary artery heart disease had no previous symptoms. This is what I tell my patients. The heart works very, very well until it doesn't, and it doesn't always give you a lot of indicator beforehand. So that's why we have to dig in and find the information and not wait for something to happen. I left this slide in here. Um, Gladly, we're out the other side of the COVID-19 pandemic, but something to just keep in the back of our minds that one of the things, the longer term effects of COVID was inflammatory, and that inflammation that was caused by the virus had an impact on increasing risks of cardiovascular disease. It's something to keep an eye out for, even for years after the fact. So what's real important is to know what your risk is, and that's what we try to evaluate in the office with lab tests and a lot more evaluation. On the face of it, as we get older, if our blood pressure is rising, our cholesterol levels, blood sugar levels, then some lifestyle factors, including being overweight, lack of nutrition. Family history certainly is strongly correlated. So we want to get all this information so we can get a sense of what your individual risk is. And here we point out that a big piece of this is what's happening metabolically in people in the United States. We're at a point now where we're pushing half of adults being overweight. This is happening to young people. More than 31% of 2 to 19-year-olds overweight or obese. I mean, these numbers are just really concerning. Lack of physical activity, people still smoking cigarettes. These are modifiable factors that, we all know we should do better, but these are having very significant impacts on our hearts. There's that old book, Men Are From Mars, Women Are From Venus. Whether you think that's true or not, is fine, but just to point out that when it comes to heart disease, and especially in heart attacks and myocardial infarctions, these things can present very differently in men and women. And it's important to know this. our classic sort of Hollywood style heart attack, big and dramatic chest pain, clutching the chest, something that happens more to men, whereas women, it's going to often be a lot more subtle. It's going to be some shortness of breath, going to feel like some heartburn or indigestion, a lot of fatigue. So just putting this in here just to keep in mind to all the people in your life that, these things can look differently. So here's a big take home here, right? So we have this sort of strong association in our minds. We don't really remember too much in the way of what our blood work looks like or means per se, but that total cholesterol number is one that people have always sort of held in their heads, right? What's your cholesterol? Oh, it's 193, so that's okay, or it's 217, so it's too high. Of all the numbers that we run, of all the blood work information that we can get, that total cholesterol number is one of the most poor predictors of heart disease. It really doesn't give us much information at all. And then even if we go under that, we call LDL the bad cholesterol. We'll talk more about that. But only 50% of heart attack victims have high LDL levels. And then we've got the fact that 50% of people who have high cholesterol don't actually have heart disease at all. So we need to get a lot more information. We need to look deeper than just what the LDL and HDL particles are in a standard lipid panel. Here's an image of what we're talking about, right? When we're talking about cholesterol and atherosclerosis, we're talking about the building up of plaque in the blood vessels, specifically the blood vessels that feed directly back into the heart, those coronary arteries, because the heart needs a lot of blood very consistently. Important to remember that this process happens to everyone as we get older. We know now that this starts relatively early in life, happens over a lifetime. We just want it to not happen so much that things build up and clog the system up or become unstable, where that plaque can then rupture and get stuck somewhere else. So here's another big take home here, right? Is that we just need to get all the information. That basic lipid panel, which has been around forever, gives us some basic measures of the weight of different cholesterol particles, and it's not that much information. We can get a lot more, and we can know a lot more about what the health of your heart is. We can look at particle numbers, we can look at particle sizes, we can look at inflammation, right? Because inflammation is the driver of heart disease. It's damage to those blood vessels from that last slide that cause that cholesterol to lay down and build up. We look into metabolic testing. We're looking at A1Cs, which is a 3-month blood sugar average. We're looking at insulin resistance because sugar dysregulation is one of the main causes of heart disease. And then in addition to all our blood testing, we're looking at calcium scoring. So this is an image, and we'll talk more about this to get a sense of how much plaque is built up over a longer period of time in the coronary arteries. And then when the case is indicated, especially if we have some concerns, some significant concerns around some of those other tests, that's when we're talking about sending to a cardiologist where we're doing things like echoes and stress tests. So a little more about cholesterol here, right? So that basic lipid panel just tells you how much total cholesterol, HDL, LDL you have. It doesn't really talk about what it's made up of, and that's what's important, right? So there's different kinds of LDL particles, LDL being the quote unquote bad cholesterol, those big fluffy LDL particles that we're not so concerned about, like on the left, versus small, dense LDL particles, which are more inflammatory on the right. We want to know what your particles look like. It is important to point out that cholesterol is not the enemy either, right? So your body needs cholesterol. Just looking here, you see some hormones you might be familiar with: progesterone, estrogen, testosterone, cortisol. All those hormones are made out of cholesterol. Your brain, indeed, is made out of cholesterol. So we need cholesterol. We just don't want the wrong cholesterol stuck in the wrong place, secondary to some inflammatory processes that are causing the damage. Another way to look at those particles, so we're looking here if you have the same amount of total LDL, like on a basic lipid panel, you could have that be a smaller number of large particles, like are on the left, which is lower risk, or you can have a lot more small particles, like on the right, which is higher risk, because those smaller particles get stuck in the blood vessels and build that atherosclerotic plaque. So, the metaphor I like to use, thinking about heart disease like a traffic jam. If there's too many particles on the road, congestion, more risk of car accidents, people driving off the road, general chaos. If there's less congestion on the road, if all those people are carpooling, then there's less congestion, as shown here. Same cholesterol levels. If there's less particles, there's less traffic, there's more carpooling. More particles, more traffic, more risk of plaque building up. The other thing that's on a basic lipid panel that we do want to know about is what your triglycerides are. Triglycerides are the cholesterol type particle that are most correlated to your blood sugar. So when we see triglycerides elevated, that usually is correlated to elevated sugar, elevated A1C, insulin resistance, and really it's the sugar that drives weight gain, right? Fat doesn't make people fat. It's the sugar. Little note here, we look at a triglyceride HDL ratio, something on the basic lipid panel that you should know about. Um, should be 2 to 1 or better than that. Unfortunately, we see people with triglycerides of 150 and HDLs of 30, and that ratio is not what we want it to be. So again, it's all about the sugar. We're still stuck on cholesterol's a problem, red meat's bad for you. There's different people respond differently to different diets, but the one thing we can say for sure is that it's the sugar. It's the sugar and the refined carbs that drive fatty liver, insulin resistance, weight gain, and atherosclerosis. Just a slide in here about what happens as that blood sugar starts to dysregulate, weight goes up, all these things, right? So there's heart disease and hypertension, but we've got our diabetes. And then down at the bottom here, some things you don't really think about, but increased risk of dementia and cognitive issues, increased risk of cancer. Here's PCOS, polycystic ovarian syndrome. All these things are correlated to dysregulation of the blood sugar and what happens when the weight goes up along with that. There's a lot of information here. Here's a list. You don't need to memorize this. The point is that there are so many other markers that we're looking at to get a sense of how healthy your heart is. If we're just going on a basic lipid panel, we don't have enough information. This ApoB is a carrier for the LDL, so it's a better indicator of overall cardiovascular risk. Everyone should know their lipoprotein A status. It's a genetic thing. Either you have it or you don't. And if you have it, it increases your heart risk, and you should know about that. Your family should know about that. We've got some inflammation markers here. There's a lot of things, a lot of tests that we can evaluate and get information from relatively easily that can give us a much better sense of what's going on with your heart. A little bit of a highlight here on lipoprotein A. Picture over here. This is a little while back now, but there was a TV show called The Biggest Loser, and the trainer for that show, his name was Bob Harper. He was a super fit, active, healthy dude. And soon after the show was over, he had this massive heart attack. Everyone said, "What the heck? How's that even possible?" Turns out for him, he had a very elevated lipoprotein A. So this was genetic, nothing he could have done about it. But if we know this, it means we can reduce our risk in a lot of other places to try to mitigate that to some degree. There are medications coming down the line to treat lipoprotein A. As soon as they hit the market, then you will hear about how important this is. But I'm telling you now. This familyheart.org is a great resource for more information around um, genetic familial hypocholesterolemia and lipoprotein A. So again, we're just kind of saying the same thing in a couple of different ways, but we need to look deeper. We need to look at inflammatory markers. We need to look into these particles, some other markers that give us a much better sense of what is going on with our hearts. Just a list here of all these different things we can test. So I don't test all this for everybody, but I test a lot of these things for a lot of people, and we can really, really get a better sense of what's going on with our cardiovascular system by getting all our information and knowing our numbers. So in addition to blood testing, like I mentioned before, I run a lot of coronary calcium scoring. So this is looking at calcified plaque. If we're building soft plaque for a long time, over the age of about 40, 45 years old, we can start to calcify it. So it gives us a sense of how much soft plaque is building up. The only way to know for sure about your soft plaque is to do what's called an angiogram, where we thread the catheter up your leg, the cardiologist does, um, up and take a look in your coronary arteries. So that's invasive. We're really trying not to do that unless we really have to. So this calcium score can give us a sense, not definitively of the soft plaque, but if it's been building up, then we see the calcified plaque. So it's an important way to risk stratify people that are sort of middle of the road as far as blood numbers go, which is a lot of people. So that's the first thing. People come in because they don't want to take statin medications or they are concerned about their cholesterol level. And the first step is just get a lot more information. So before we do anything as far as treatment, we just need to know what we're really dealing with, and that's what the testing is. Once we have a sense, then we start with treatment and support. And that, just to remind everyone, always starts with the basics, right? These foundations of health, how we sleep, how we move, how we eat, how we manage our stress. These things are so important, so necessary. Um, there's no way around them, right? We can't not do these things. We can't supplement our way to heart health. There's not just a replacement for a statin medication. We have to do the work, and this is where that comes from. So we'll just kind of talk about those things a little more. It turns out everyone knows they should move more, and here's some recommendations around that. 150 minutes a week comes to about 30 minutes 5 times a week, 30 minutes a day, 5 days a week. Additionally to cardiovascular exercises, weight-bearing exercise and lifting weights is super duper important too. Some great research around lowering risk of heart attack and stroke with incorporating some weight-bearing exercise into your cardiovascular activity. Great study out of JAMA, 10 minutes of moderate, vigorous exercise daily may prevent 110,000 deaths annually in adults over 40. We just have to get started. We just have to move a little more. People always ask what the best kind of exercise is. Turns out the best kind of exercise is the kind that you will do, the kind you don't hate, the kind you enjoy a little bit, because it's all about being consistent. If pressed, for a lot of people, the best thing, the most efficient thing we can do is some type of interval training. So that's varying your heart rate a little bit, right? Mixing it up where it's kind of going up and down. This is going back a little bit, but the 7 minute workout, turns out there's some really great research around it. I think there's an app for it now. If you're not doing anything, think about committing 7 minutes every day. And then, gosh, what's the best thing to eat, right? So there's so much information out there, so much conflicting information. What's the best thing to eat? Should I eat keto? Should I eat carnivore? Should I intermittent fast? What? It's just too much information. There's not a diet best for everybody. Genetically, we're different. We can evaluate that by testing and looking what the numbers do with different dietary changes. But generally speaking, a Mediterranean diet does still cover the most people most of the time. This is whole foods, um, healthy fats, whole grains. Down here, the important thing, regardless of what you're doing and how you're eating, is to limit and avoid most processed foods, refined sugars, and the processed meats. Sleep also so important. All these things we're talking about keeping inflammation down, right? So if you're sleeping less than 6 hours a night, you are causing inflammation in your body and developing damaging plaque in your arteries, in your entire body. These numbers are really incredible. 6 hours, under 6 hours a night, 27% more likely to have body-wide atherosclerosis. The body needs that sleep time to help recover and restore. We need to allow for that. And then, after we talk about all the testing and we talk about all the foundational lifestyle changes, then, only then, do we talk about supplements. And we have those too, right? So, Um, just to run through a couple here, and this is really dependent. We're testing these things. There isn't a straight, everyone gets this or everyone gets that. Really, we individualize treatment, obviously. But I do use a lot of omega-3s and fish oil. One thing to note around fish oil, there's some studies around increasing risk of atrial fibrillation. So if that is a risk or a concern or something that's diagnosed, then we want to avoid fish oil. Eating fish is great, but not the concentrated fish oils. But lots of people on magnesium, uh, important for all muscles, including the heart. List of some foods that are rich in magnesium: whole grains, fish and seafood, dark leafy greens. Turns out dark chocolate, lots of magnesium. There's coenzyme Q10. If someone happens to be on a statin medication, it is important to add a CoQ10 supplement because that also gets depleted by the way the mechanism of the drug works. But we use CoQ10 blood pressure, and some heart cardiomyopathies. In some cases, we use niacin to help reduce LDL levels. It can also, in some cases, reduce lipoprotein A a little bit. It can increase HDL. Um, there is a flushing reaction that's associated with that, so we need to watch for that. I don't use a lot of niacin, but in some cases, it seems to work very well. There are a lot of different kinds of niacin out there. This particular one, this inositol form, this is flush free. It's not what we're looking for. It doesn't work very well. It is flush free, but it also doesn't really move the numbers. So we need to make sure we know what we're getting as far as supplements in general. In some cases, we use red yeast rice, which is essentially a naturally occurring statin. The same mechanism of action by which statin medications work, not quite as strong, but it does seem to lower those LDLs in some people very well. Doesn't affect particle sizes very much, but if you need to pour some of that stuff out of your bucket, then it can do that. Some growing research around berberine. I'm using it clinically more. Um, Helpful for cholesterol uh, improvements, lowering LDL and triglycerides, can have a positive effect on blood sugar and diabetes type issues as well. Hawthorn is one of my favorite herbal medicines. We use it for strengthening and tonifying the heart, many different kinds of heart issues, blood pressure. In some cases, we see it affect cholesterol, lipids a little bit, not usually too much, but super nutritive and incredibly safe. Great study here. If nothing else, consider getting a dog. Dog ownership associated with significantly lower all-cause mortality for cardiovascular disease. And why is that? Probably getting people moving a little more. And we can't, underestimate that emotional connection that we need. And sometimes people don't have so much of it as they get older. So I love this quote, your heart is the softest place on earth. Take care of it. That's what I try to do every day is help people to do that. Know your numbers, get tested, get the information, and then we can make some positive changes to keep your heart healthy for a very long time. Thanks so much. If you have any questions, please reach out to our office. Um, I see patients in Manchester and in Stonington, and would love to connect and help you to keep your heart healthy. Okay, bye-bye.